All right, we are recording, so whenever you're ready to begin.
Okay, good morning, everybody, especially those in Malaysia. Okay, this part of the morning, it's 11 o'clock in the morning. And the topics of our discussion today is advocacy policy change to support development of academic programs in addiction studies and to enhance addiction prevention and treatment services. Okay, my name is Zall. Currently, I'm academic program coordinator in addiction studies, UC Cyberjaya of Malaysia. Before this, I was with prison department for almost 33 years, and then teaching for almost 15 years. Sequence of our presentation is introduction, then we have proactive marketing teams, policy change, a little bit, and enhancement of services. Okay. In this webinar, we don't intend to propose any legal big advocacy or policies change. Since I'm a strong believer in ICCDR and ISAP programs and initiatives, I am following the DDR course funded by NINL since 1979. When Malaysian prison started its first drug rehabilitation and treatment program for inmates with addiction problem. Okay, our main concern here is to highlight what contribution can be offered to ICU DDR in its vision to accomplish the worldwide dissemination of addiction study. So in doing so, we will touch a little bit of policy change to support development of academic programs in addiction studies and to enhance addiction prevention and treatment services. Okay, as addiction science is a new academic field, I think disseminating of idea to university worldwide to get the idea accepted and finally encourage the university to offer the course are certainly a real big responsibility for ICDDR to shoulder it all alone. With that in mind, we want to share our idea on how we can, as a member of DDR organizations, have to take some weight of the problem from ICU DDR. Okay, the issue we want to talk about has some implication on current policy, but potential benefit many. My co-partner Aisha will talk about enhancements of treatment and prevention services. Our main question is, what if people who have been sponsored and trained as professional trainers by DDR parent organization, even INL, ICCDR, ISAP, and Comoplan, if they are allowed to take some part of responsibility, particularly in marketing, the UTC and UPC, and help the local universities in developing addiction science. Okay, the answer, of course, will be yes or no, but to us, we say yes. Okay. ICU DDR has had trained many professionals, so far, and from many different countries. So, if these trainers are organizing in form of self-motivating team, just imagine, can there be any UC in their country spare from their visit and marketing plan for UTC and UPC as academic program, especially if they are paid to do so. So in this case, we propose a team called Proactive Marketing Team, PMT. Okay, how it works? Instead of waiting for UC to approach ICCDR to start a DDR program, it is PMT responsibility to approach the local UCs in attempt to furnish them with information pertaining to UPC and UTC and convince them to start addiction studies program, ESP, proactive team. Objective of this team, okay, well, number one is to support development of academic programs in addiction studies by consulting and introducing the evidence-based UPC, UTC, and UPC to universities. Okay. To get as many local universities as possible in offering addiction studies at the level of at all level of education program. Okay. Number two, objective, acting as go-between ICU-DDR and the universities in disseminating addiction study worldwide. There's two objectives, main objectives. Okay, rationale why we focus on creating proactive marketing team. Okay. Number one, cost effective. PMT will be a self-funded team, group, company, or small organization working at a ground level, supporting ICU DDR to accomplish its vision of disseminating the idea of established addiction studies programs at the universities. Okay. So academic program can be in form of undergraduates or postgraduate program, or even diploma or an elective paper. This is how we disseminate the seed of the program. Number two, PMT is timely. We know that ICU DDR currently conducting training, the global DDR training series. This can also be part of marketing skill development workshop for PMT team. Okay. With PMT, trainers can fully utilize as they can create their own training activities. You don't have to wait for a parent organization to call them for training. Number three is direct. Okay. PMT have a direct communication, direct in providing local universities with information, as well as training, consultancy to support the development of academic programs in addiction studies in universities. Okay. Three. Then we have this, how we, the former approach is top-down approach we have from NNL to any grant or any financial aid to CUDR or ISAP, then it goes to UC. Now instead, top-down, we propose a bottom-up approach. Now we have all these PMT all over the country, I mean the member countries. So this PMT will directly connect to communicate with UC. Okay, in their local, in their own country. You just imagine how many countries we have and how many universities we have. Okay, so if we have this kind of teams, they can go everywhere. Now after that, we have to report back to the teams that report. They have the obligation, they have this responsibility to report to ICUDR. All the activities, whatever activities they have done with UCs. Huh? Okay, we have 5 characteristics of PMT, and this one has something to do with policy changes. So it's a bit of touch policy change. The first one is funded, self-funded, and this team is profit-making company, okay, or association or whatever you call it. So financially less dependent on parent organization, especially ICU, DDR, or other organization. Okay, they are self-funded. Secondly, it require this is again it require ICU-DDR education provider status. So currently, this status are given to UC members, not to organization company like what I'm saying now, profit-making company. Anyway, this is important because we need this because it reflects direct communication, direct connection. PMT is having with ICU DDR. This is important. Okay. Secondly, it helps in marketing UTC and UPC. When you see something that a big organization is behind you, so they will easily to get convinced. Number 3, the staff. Sorry, we have a problem here. Okay, sorry. Number 3, we have the staff trained by ISAP and ICUDDR, evidence-based UTC, UPC. Okay, now the staff is trained by ISAP and ICUDDR, but then they use this skill from the training to start PMT and make profit a lot of this. So this is quite a bit against the policy, I think. Okay, they are equipped with DDR trainers who are academically qualified to teach at the university and also as a consultant. Okay. Then the last one is provide training consultancy and for staff, university staff. So these people are also responsible for training the staff of the university. Yeah? Okay. Number 5, PMT report for answerable to ICUDDR. Apart from acting as a go-between the universities and ICUDDR, PMT also responsible in reporting and get advice whenever possible, especially things that related to parent organization policy. Yeah? Okay, advantages of PMT. PMT is agents for the development of addiction studies. They can create their own training and consultant activities and become fully utilized. As a company or organizations, PMT has direct and better access to local universities of their own countries. Okay? So we use people from the country itself to approach the university in their own country. Financially independent, less depending on ICUDDR. Okay? They have their own money to spend on the activities. And also the final point is PMT report to ICUDDR. So even though they are established on their own, but they still have to report to ICUDDR whatever program, whatever activities they're doing, which is related to ICUDDR. And finally, you can see if Aisha can show the picture of the big boat and small boat. Okay, so okay, this is the one. You see, oftentimes to be effective, a big ship needs the services of small boats, especially when they stop at the harbor. So these small ships, PMT. So the more PMT we have, okay, the more members, country members we have, okay, the more watts we have a wide network to establish this program in university. Okay, now I give it. I let Aisha to have it. Aisha.
Okay. Thank you very much, sir. You've done very well your part. Now it's my part, the enhancement of addiction prevention and treatment services. I just want to introduce myself a little bit. You can see I'm basically a global master trainer, PGTS alumni with University of Cyberjaya. I'm also consultant with STNC in Malaysia. I worked as Director Research and Monitoring and Deputy Director Drug Demand Reduction in Ministry of Narcotics Control, Pakistan, and also as Drug Demand Reduction Officer in Anti-Narcotics Force. Basically, I'm a researcher, columnist, and I'm a prose writer as well. Thank you. So I put the significance of the services here, and being a DDR professional, I feel that especially at this time, the university qualification and university degrees are the need of the hour. So I try to put this in a ring pyramid so that we can understand the significance of the services and also the significance of our specific university qualification in DDR. So it is very important right now because if I talk about myself, that I have 14 years experience, I have degree in psychology, I have a lot of trainings, but I feel that this is not enough because we need a complete university specific qualification that is most relevant to my experience or being a professional to our experience. So at this time, because the world is now getting changed, and especially this field is now recognized by every department in the world, how significant it is, the significance of addiction professionals. So I think we should go for the better qualification, better degree, so that we can enhance our skills. So the significance of addiction prevention education is also important because we go for the treatment first, and then ultimately we need to go for the prevention because prevention is very much important, and it should be taught as a university degree program. More opportunities for the certified professionals because we have a lot of certified professionals with ICU DDR who are ICAP 1, ICAP 2, ICAP 3 in all over the world. I also did ICAP in 2013 first time, but I realized that this is not enough because the 2 days, 10 days training, 15 days training, doing the ICAP, doing the other programs, this is not enough for us to practice or to enhance the skills. So there must be much more opportunities to get the education and qualification to update and enhance the knowledge for the addiction professionals. Promotion of evidence-based practices, of course, it is very important that we need to promote EBPs more and more because, as you know, before this decade and in last 2 decades, we can say up to 2000 and after 2000, the work is started on the evidence base. Unfortunately, I belongs to Asia and so many Asian countries, there was no EBPs. And it started after 2008 or 2010 when initially Colombo Plan started training on UTCs, and then people start realizing that they want to go for the treatment and they need the evidence-based material to practice in their treatment centers. So the quality of the services will definitely enhance when we will have more professionals who are educated, who have the degree, who spend time on their degree, who learn and who go through the practicality. Then we have definitely quality services. Here I just jot down some academic openings, how we can enhance the addiction prevention and treatment services with reference to academic openings. Number 1, introduce the degree program in PGDS like postgraduate diplomas like we did in University of Malaysia and Masters in Addiction Science, and especially PhD programs are very much required, like especially on the prevention, because I always say that the prevention is a new subject. Before going to treatment, we need to learn about the prevention, because if you have prevention in your community, in your environment, in your society, then maybe you have better chance to reduce or minimize the problem or related to the addiction or dependency. So other than these degree programs, we also need to introduce the non-degree programs like some trainings, some visits, or you can offer, universities can offer some internship programs and fellowships, this type of short courses, or you can also offer the awareness programs, like they can celebrate the awareness week. So this will enhance the significance of prevention and treatment services. And then the short research projects, like in our university, Dr. Zall, he's also teaching the undergraduates and graduates, and they have one subject in addiction sciences, They are right now they are teaching in university, and he's also giving them a short research projects and assignments. And this is which I observe that this is really enhancing their interest and their competencies, especially related to the addiction field. So this type of short research projects and courses can be offered to the students who are related to this subject, and also for the professionals. Training and recruitment of addiction professionals. I think this is the time now we should seriously think that we should have the addiction professionals and certified professionals in universities, in the department, so that they can teach well and they can train the people, they can train the students, they can train the community from there. Include the addiction counseling services in student counseling services. As you know, almost all universities has the student counseling centers, and I strongly recommend that there should be the addiction counselor in every counseling center, because the most of the time the students and even from the staff, they need this type of services. And then exchange of the students. This is actually for me it is a very good idea. If one university is offering the course PGDS, postgraduate diploma, or they are offering the master's or PhD, they can exchange the students, and the students can learn from the other universities, from the other teachers, from the other professionals. This will enhance their capacity. Exchange of the staff. This is also very important and significant. Like I was studying in University of Cyberjaya, and there was another university, and some staff, they came over from there, like they were teaching us the counseling. The one he was teaching us the case management, the one he was teaching us the pharmacology and the addiction studies. So it is a very good idea, like especially for the professionals, because this is a good way to exchange the ideas and information. So academic openings may include, we can do that the guest lecturers, we can invite the lecturers, addiction professionals from not only from the universities, we can also invite from the NGOs, from the treatment and rehab centers who have the professionals. We can invite them in the universities, they can conduct the lectures. And DDR should taught as elective subject at all levels, like undergraduate and postgraduate, to create the awareness and interest toward the subject. I think this is also very significant and need of that time that we should include, especially the universities, especially who are connected with ICU DDR. At least in those universities, there must be, all these segments must be present over there. And then scholarship and research grants. This is a very important and significant topic, especially for all the professionals, including me, because I think I saw there are so many scholarships, so many projects and research grants for the PhD and postdoctorate. But still, the ratio on addiction sciences or drug demand reduction is still very low. I believe that the universities should take an active stance on this subject, and they should also offer some grants and some research grants and some projects for the students, so that they can, professionals and the students of DDR, they can easily apply for that. DDR as a part of student activities, the student can do. They can do the research and publications. They must, at least in every journal of the university, there should be at least 1 or 2 researches that must be related to DDR. And then seminars related to DDR, prevention and treatment for the both. Workshops, they can conduct the workshops. If they are education providers, then they can conduct the activities like trainings on the treatment, trainings on the prevention, and on the subject. They can also arrange or engage the students in different debates, and like they can give them the current topics, what are the recent trends, how the people are getting into the drugs, how the youth is attractive towards, especially in this situation, in COVID situation, we are observing that the situation is getting very critical with related to substance use. So this type of debates, online webinars or seminars, this will be very effective, especially to enhance the services. The study visit to DDR treatment and rehab centers, this is really very, very useful, because not being a student, but when I was working with Ministry of Narcotics, mostly when we host some visits from the even from outside the country, even from the different other institutions or departments, we must try to arrange their visit to our treatment center. It was the Model Addiction Treatment Center by Anti-Narcotics Force. The reason is that you can learn a lot of things on ground when you practically see the clients, how they are working, how they are living in the treatment center, how the professionals are working, how what the counselor is doing, how the psychologist is treating them. So this is a very useful, and especially it will give the students and professionals a good chance of learning. Like recently when I was studying this PGDAS, we visited to many treatment centers, especially in my country. I never attended a full-fledged session on the different different therapies, including this TC model and other model, because just wanted to learn what is this, because we don't use TC model at all. We using some other EVPs and other practices in Pakistan, and especially alcohol-related meetings, NA meetings. It was very different experience for me. So I think this type of activities are really helpful to enhance the services and understanding, develop the understanding for the professionals. Celebrating the DDR days, other than 26th June, we can celebrate in our university, in our institute, just to create the awareness. We can invite the parents, we can invite the other university students and teachers and lecturers, and we can set up the stalls, can have the debate and some information, put the slides. So this type of activity can enhance the quality services. Social opportunities, especially in the COVID, now we are going to be the social freaks, and all the time we are on the social media, we are doing the webinars, we are connected through social media like Twitter, through Facebook. So at this time, social media is a very, very useful and most significant tool. So we can use this tool in this program as well. We can introduction of the prevention programs, including the environmental and community prevention, school prevention, family prevention, by involving the stakeholders like community, our government, media, and other stakeholders. Then a university can do online short courses on DDR, which are actually very effective. One more thing I observed, that since we have the lockdown in the third month of this year, I saw there are so many online courses. There are so many universities, renowned universities, they are offering the courses on mental health and the well-being, personal care. So we can offer this type of short courses online on drug demand reduction that can contain the awareness, they can contain the treatment and other prevention, especially treatment and prevention services for the professionals. So we can do these type of online courses. Activating the community leaders, inviting them for the public speech, as well as arranging the lectures for the students. Evidence-based teachers training and parenting program. Fortunately, especially the universities who are related to the ICU DDR, and they are the education providers, through Colombo Plan, we have UTCs, we have UPC, coordinated series, and implementer series. We have curriculums on women treatment, we have curriculum on child treatment, and some other subjects. So this is a very good opportunity because we have the material. The basic thing is that we should have the concrete evidence-based material. So we have the material. We just need to kick off our activities. We just need to take one step. So this is a very good and best opportunity if you are sitting inside the home, especially in this situation. We can offer a lot of services, evidence-based trainings, and even the parenting programs through this connectivity. And at this time, because all the students are online, and because they are working or studying from the home, so it is very easy to engage the parents. Like after the session, maybe once in a week you can engage the parents. And joint ventures with local and international DDR organizations. Like I always say that we have a platform like ISEP. Now this is the platform actually for the professionals. This is the face of the professionals. So all we professionals can go there and gather there. Then we have Colombo Plan, we have UNODC, we have a lot of platforms from where we can express our qualities. We can express what we are, our competencies, and we can also learn from there because we have a lot of professionals over there, and we are blessed to have so many our seasoned professional over there. From them we can learn. From them we can do with them we can do the joint ventures. We can do a lot of things. So the special collaboration with the health and narcotics departments. I think every university they must have collaboration with the narcotics department, like the Ministry of Narcotics, or especially with those sections who are working on the drug demand reduction, because drug demand reduction cannot be completed without universities and especially the youth segment. So I think this can help a lot for enhancement of the services. So this is also very important part, financial opportunities, and which seeks by the NGOs, organizations, by the treatment centers, and also for the professionals. So how the financial opportunities can be created in for the professionals. Social research grants, as I earlier mentioned, that every universities and some departments and some governments, they have the research grants. So some research grants must be allocated to the DDR activities, DDR related researches. Special bursary scholarships, dean scholarships, mostly the universities have vice chancellor scholarships. So I think there must be the one scholarship for the DDR. And international research scholarships, like there are so many university programs in Europe, in America, and Australia, and Canada. They have international research scholarships. And I believe that at least they should nominate few scholarships for DDR program. And then national scholarships, HEC scholarship, Higher Education Commission scholarships. Every country they have Ministry of Education, and some of them have Higher Education Commission. So I believe that they should also announce some scholarships specifically related to drug demand reduction. So role of the electronic and social media, we already discussed in the previous slides. So what we can do as professionals, how we can learn as a professional. In the both ways, we can conduct and we can attend the online webinars, debates, trainings, distance learning programs, series of lectures via YouTube for professionals like in ICUDDR or ISAP or Colombo Plan, whatever or UNODC, whatever the webinar they are doing, they are uploading it on the YouTube. And I think this is the very, very best, and this is the best, one of the best opportunity, because 5 years back or 3 years back, this opportunity was not available for us. Like we just, most of the time we used to travel, we go to the other place and attend the trainings and come back. Now at this time, if we miss the session, then we can easily get it from the YouTube. So I think at this time, we professionals, we have more opportunities for learning. The series, then the use of social media tool for capacity building. We can, like it's already doing, like these tools are helping us to build our capacity as a professional and as a student and as a learner as well. So we can use it in more appropriate way from the platform of the different universities and organizations. Thank you very much. This was my last slide, and I hope we are able to explain few points. So I will give the floor to my teacher and my mentor, Dr. Zall. Thank you.
Thank you, Aisha. A good presentation.
Thank you.
Okay, I think we have done our part. We explained those things. You see the whole thing. Advocacy policy changes for development of academic programs, direction studies. The first part, and the second part is enhance addiction prevention and treatment services. So as you say that some changes need to do. We can do some changes at the policy in order to make things more appropriate with all level of professional. So if you just train people and don't have that, then have do their own things with the skill they get from this training, so they might lose a lot of things. Okay. So as we say just now, that the advantage of PMT, proactive marketing or maintenance marketing team. So we can see it can act as an agent for development of addiction studies. Okay, they have been trained, so they have a lot of skill. They can teach people. Okay, they can go and help use this to develop the program. Then secondly, creating its own training and consultant activities become fully utilized. Probably just wait for this parent organization to call them for training or to be forced to do something. But now they can do their own thing. Okay, as the group is self-funding. Yeah? Then also we just imagine a company, PMT has a direct access to local universities of their own countries. So if we have, let's say, if we have 30 countries members of ICCBR and we have trainers more than that, so these people can easily go access the universities and talk to them in their own language. Okay? So easily can convince the people, and we hope that they can easily make the university offer this course. Okay? So with that, I think we have done our part, and we hope that. Aisha, you have something to say?
No, sir, thank you very much. And I hope especially our professionals who are working in the universities, and as you said that if there are at least 30 countries with ICU-DDR, their universities are working with ICU-DDR. So this is actually the biggest platform. We can start from here, and we can do a lot of things. So thank you very much. This is what I wanted to say. Thank you.
All right. Well, thank you so much, guys. Is there anything else, or?
I think that's all.
We're all done. All right. Well, thank you. Thank you guys for those great presentations. I'm sure everyone will enjoy this on YouTube later.
Thank you. Then I will read that to Pen. Kim.